Okay, so let's revise today clinical communication skills and practice some few stations of your own choice, but we need to practice these things. So like you can write down some point we need to, like you will all be today with me, the tutor, you all taking part in giving feedback, and you can give feedback to yourself and to others as well. So we need to see the things that we need to cover in our station, in the lab 2 station, including communication skills, IPS sentences. We need to learn more of them. So please mute yourself because there is some noise background. Unless you want to talk, you can unmute. Okay, so like just our general frame to our history, and you all know it very well. So the first initial part is to establish the rapport with the patient. So this include like even like just for example, can I confirm your name and age? I will tell you, for example, my name is John. Nice to meet you, John. So just even from identity check, we need to show something nice. So we don't miss in all the station, every single lines we're going to check together. We're doing something good for this patient, apart from the medical things. So if you have any station, regardless, you know it, you don't know it, at least you can get very high mark in your communication skills. And at the same time, so you will increase your marks automatically to other parts. And this is what examiner do. Okay, so the building a rapport, for example, how can I help you? So I said identity. When they tell you their name, you can say nice to meet you. Or if, for example, over the phone, can you please, can I confirm with you some ID check, confirm your name and age and address, please. So if they said it back to you, thank you so much for confirming that. Thank you so much for confirming that. So first line, like introducing yourself or confirming identity, you have to give me some sentence here. Okay, so I'm going to take you all the steps, up to the end of the station. We need to make sure we're addressing every single part. And all of you need to write down all of you practice, you need to write down what could this doctor said in this line in terms of IPS. So identify the reason for consultation. So how can I help you? So if like GB setting, I came here for my result, I came here for diabetes review. So normally it would be cold case. So we say, thank you so much for coming today. Or we say, I really appreciate your coming today, and I will do my best to help you in this regard, whatever the reason that's bringing them. But if it is like emergency setting or patient has acute problem, like headache, chest pain, dizziness, whatever, they have symptoms, acute problems. So it's better to say, I'm sorry to hear that. It sounds quite difficult, and I'm here to help you. So offer reassurance as well. So acknowledge it, and then reassurance. After that, you need to gather information about the presenting some complaint. So can you tell me more about it? Can you tell me more about it? So always start with open question. And when you say, can you tell me more about it? Give the patient time to tell you. Don't follow it with the next question. Like I noticed some people say, can you tell me more about it? When did it start? Where is it? Where exactly the pain is? So don't say your close question straight away. Give open question for the patient to give you the story, the whole, everything they have. And then you can continue with your close questions. What they didn't answer, you can continue with your specific questions. And it's really important, as I said in BLAB 2, to have your structures. And we spoke a lot about the structures. No one should mess it around. Counseling stations, breaking bad news, whatever the station is, we will follow exactly same structures. So it will be very easy for you. So if it is, say, if it is counseling stations, so just current situation, assess the current situation, what the patient knows about their father's condition, blah, 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 blah. So assess the current situation, current reason for their appointment and just explore it more. And then still you can ask past medical history. Most of the time it will be relevant because they will ask you concern in the end when you reach the management part. So if you have a background information, it will help you to address the concern. So always ask your past medical history, and then examination, investigations. Sometimes in the counseling, they may not be relevant in some few sessions, but most likely to be relevant. So again, you just, if it is like, you don't need, like in the real life, you wouldn't read to examine this patient. So it's just about saying it in general, quick general physical examination, vitals, and chest examination. You don't need to specify. But if you're doing like history-based session, you have to specify exactly what examination you need to do and speak about details. Yeah, but you can say just, or even you say just, I will call your child, for example, to the GB to examine him. Sometimes it could be enough if it is about counseling station, but if it is history-based or we have medical problem here, you need to mention the examination. Investigation, management. So management, it's really important to involve the patient. Like, just don't say, I'm going to give you painkiller. Say, would it be okay to give you some painkiller? So it's always ask them for permission for the management, give them option and let them choose if there is option. If there is no option, just tell them and ask them if that's okay. Always ask, is that okay? At the same time, you need to do in the management, like general framework. First, try to find out if this emergency situation or not, if there is anything need to be urgent. For example, GB setting, but the patient has chest pain, you need to send the ambulance for him. So just think about if there is anything, and in your history as well, you will think if there is something acute, you need to, like something urgent or red flag, you need to exclude to make sure that you are not missing something important. And then symptomatic treatment, okay? And then further plan of management regarding to what you have. If you have investigation in hand, you can tell them, from my assessment and investigation, you seem to have this conditions and the treatment is blah, 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 blah. Is that okay by you or not? And then further plan of management, including checking with the consultant if there is anything more you need to add, if there is any need for referral, if there is any need for further appointment, like follow-up appointment, and the safety netting. So this is like major things. You will mention them, you know the station, you don't know it, just start with this, make it as a habit to tell about these things. Symptomatic treatment, always, we don't miss. And then tell about what's possible. For example, let's say you don't know the diagnosis. So from my assessment and the investigation, if there is investigations, there could be some few, or sometimes they don't give you investigation results. So from my assessment, your symptoms could be due to some few possibilities, or there could be some few possibilities that causing your problem. We will do further investigation to find out what exactly causing it. However, I'm suspecting if you have some DD in your head too, still you need to tell the examiner you made some effort. If you don't have, it's fine. But if you have your DD, you can mention them. I'm suspecting a condition called this. But as I told you, we need to, I will need to ask my senior to come and review you and also refer you to specialist, whatever, for further assessment if that's necessary. Just the most important for them to know that you are safe doctors and you know your basics and you know your history really very well. So the history, if just try to explore, like let the patient lead the station, and just every time they tell you something, try to explore these things they're telling you, whatever. Don't try to make up the diagnosis by yourself and focus in it and ask DD related to it. Let the patient guide you what exactly the problem is. So you'll find them, even if you, like, just imagine you don't know the station at all. So if you tell the patient, what brought you headache, can you tell me more about it? And you ask your Socrates, and this is something you need to learn by heart. For example, Socrates, you shouldn't miss any question from it. Or Odibara, which is like Socrates, just minus few questions. and know how to elaborate symptoms. Like if you didn't master these things, give it a time, even 3 days, 4 days. Give yourself time to make your history perfect. Like whenever the patient telling you, for example, diarrhea elaboration, if the patient telling you I have bowel problem, so you need to know to elaborate it in depth. If, as I told you, about vomiting, about seizures, about so learn to elaborate the symptoms. Whenever in the exam they told you this, elaborate in the same way. You already prepared right now. And you can write notes, like for example, headache, we ask this and this, and Socrates, for example, any pain, Socrates, vomiting, we'll ask this and this and this. So for example, it's really important not to forget about vomiting blood or amount of vomiting, episodes of vomiting. So this kind of things you need to remember. And every time the patient mentions these things, ask them about, ask him or her about this. So it will make your life in this exam very easy, and still keep your structures. If don't like if the patient brought the investigation too early, don't even if the patient insists to explain the investigation for them, and you ask them, is it okay to ask you some few questions, and he said no, still explain to them, and then try to go back to your structures again, symptoms, past medical history, personal history if you need it, examination, investigation, management. So always remember to keep your structures. And we have the communication skills part. So communication skills, you have, I have made lots of sessions up to now, and papers like sentences. I told you a million of times to remember them. I hope you already did. So try to include them as much as you can. So so this one is like when you gather informations, you need to help the patient tell the story. As I said, just using open questions and then finish with the closed questions. And one of the major area of communication skills is attentive listening. Like you have to be present when you listen to the patient, and you need to show off that for the patient that you're listening to them. So you can use verbal or non-verbal, like for example, reflective listening. You just tell them, you mentioned you have headache and blah, 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 blah. So you're just repeating what they're saying, or you can reflect on their emotions. This could be very difficult for you. I can see how this affecting you, this kind of things. Or you can just use non-verbal clues, like just nodding your head, or using words like yes, I see. So picking up on verbal and non-verbal cues, always clarify. Like even if the patient sometimes intentionally in lab 2 they speak too fast for you, they need to check. Don't feel shy to ask them, would you mind to repeat that again, or would you mind to explain it more for me? Don't always ask for clarification, and even when you start working, you have to make sure you get the right picture. So try to clarify what you get from the patient. Even you can summarize back if you are not sure, and ask them, did I get it right or not? And you can use summarization throughout the history. Like as I said, after you finishing history of presenting illness, you can summarize what they told you, all the positive finding, and ask, have I missed anything? So let them add up on this before you move on to your TD. And we will continue. So always as a part of communication skills, don't forget your ICE questions, concern, idea, expectations. Always ask them before the past medical history. So attentive listening, like this is some area of it, like wait time, just give the time, the patient time to speak, and at the same time give yourself time to listen enough without interruption. And without interruption is extremely important, this word, because if you interrupt in BLAB 2, IBS will be 0. So no interruption. Make sure the patient is stopped. and give them some few seconds before you start asking questions. Don't rush, don't go so fast in your lab station because you panic of the time, not allowing you to finish. Not allowing you to finish what? To finish the script. Just as I told you, I will say it million of times, the script, it will never make someone to pass by itself. Unless you have the right skills to use it and have the right communication skills and have right listening skills to the patient. It's not just about covering everything medical knowledge in the script, it's about to address this patient in front of you, concern and show good listening skills to this patient. So don't rush to finish, listen to the patient and explore what they're telling you and give them time to talk. Can you tell me more? Don't rush them and don't move on to the next step unless you make sure the patient has finished already. And whatever the patient telling you, take it serious, explore it more. Can you tell me more about it? And this is sound and acknowledge it. This can sound quite difficult. Your work is really important for me. I am really interested to listen a lot more about it. Can we just, if like brought it in the history of presenting illness, and you don't need to speak about social life now. So tell him your work is really important to me, but do you mind to speak about it a little bit shortly after I just finished about your headache, because it's really worrying me. So just tell him this is more important, your health, but still you are concerned to listen to him. Never ignore them, never rush them to just answer your questions. It's about them, it's not about you. And as I said, facilitative response, like saying, go on, yes, I see. So this kind of things, you can use it to encourage the patient to speak more. And also like nonverbal, like using your head and your facial expressions. So keep eye contact always in the exam. So some of us in our culture, we don't stare a lot in the, especially female to male. But in this country, if you didn't keep eye contact, it's rude. So it's not staring, but you have to keep eye contact. You can break it a little bit and continue keeping it again, but you can't look down while the patient talking to you, because this is rude. And as I said, always pick up on verbal and non-verbal cues. So the things that they will test your communication skills, the patient will tell you verbally that in severe pain. You have to acknowledge that and offer support. The patient will tell you, I'm really worried, doctors. You have to acknowledge that. The patient will tell you, I'm really anxious. You have to acknowledge that. The patient will tell you, I'm so impressed about this. You have to acknowledge that. The patient will tell you, I'm so worried about my son, whatever. You have to acknowledge that and offer support. So this is very obvious. You shouldn't miss. When the patient tell you emotions, I'm distressed, I'm nervous, I'm worried. So you have to acknowledge this immediately. You can't miss it. But sometimes even they will check you on nonverbal cues. So in BLAB 2, they are very great actors, and whatever it appears in their face, they mean it for their BLAB 2. It's not something by chance. Like my rubella station, I had in my exam, rubella station, rubella negative, blah, blah, blah. So the patient has red eyes and is very strange. I thought, why is this patient dealing with me like this? So in the station, like she's taking drugs now, and even I didn't ask her personal history, but they're giving you clue. She's patient under influence of drug. Okay, so this is just more sentences like to add to the list we already had to make you more flexible, but still you have to practice saying them with the tone, otherwise they are considered by the JMC examiner as stock phrases. If you give them the tone and you slow down when you say them and you looked at the patient in the eye, like when you say, I can see that, I can see how this is difficult for you, for example, you have to look at them in the face and see if it's difficult or not. For example, this sounds quite difficult. So I'll look at them, see if it's difficult or not. Otherwise, you are not showing any sympathy or empathy, you're just saying stock phrases. Like some doctors say just, I can see how this is difficult for you. Can you tell me more about the headache? So you don't ask any question. When you acknowledge emotions, give the patient chance to tell you about this, if it's affecting them or not, if is this true or not. And if they didn't speak anything, you can continue, but give them time. Slow down and give few seconds before you continue asking your questions. I'm sorry to hear that, sound quite difficult. I would always add, I'm really, so it makes it even more sympathetic. I'm really sorry to hear that. I'm really sorry to hear that. So always say it like this. Also, this is like I told you about it, learning difficulties. Like from my note, I understand that you have some learning difficulties. Can you tell me more about it, just to make sure that you're getting the best out of this consultation? You're getting the best out of this consultation. Now I'd like to ask you some questions about it. So I said, like, to make yourself organized, when you move from section to other, you have to signpost by this sentence. Now I would like to ask you some question about your medical background, for example, or your personal history. And it's not only for organizing yourself, but also for asking for permission. Like now I'd like to ask you some question about your personal lifestyle. Would that be okay? Okay. Does that sound all right? Does that sound okay? How does that sound? So you can use any one of these same, just sometimes in the same station, you can change the language a little bit. Does that sound okay? How does that sound? Okay, we will be here to support you with it. So just when you acknowledge any feeling, I can see that how bad your headache is, please don't worry, we will be here to support you with it. Would you like me to describe you some painkillers to help you with your headache? So as I said, in the management, ask, would you like? So ask for permission. Don't just tell him, we're going to give you some painkiller, we're going to refer you, like some doctors do the mock with me like this. So so from my assessment, you have migraine. I'm going to give you some painkillers. I'm going to give you, refer you to the specialist. So in this country, it doesn't work like this. You can't tell the patient, I'm sending you like this. This is like you taking the rights to decide about this, if this is okay by them or not. So it has to be shared decisions. If they accept it, yeah, they came to you to get your help, but you can't assume that you have the best help for them. Maybe they don't want to take painkillers for any personal or religious reason, anything. You will never know. So always ask for permission when you prescribe like when you reach the management, like even when you reach here 6-minute bell rang, you will be distressed and you have lots of things to cover according to script. So you will be panicking to tell, but you will not get enough marks for the management. So many people tell me, like, I covered everything the management, I get only one. I don't know why. Because you didn't tell the patient the management, you didn't describe what the management involved. Like even you say refer to specialist for what? The patient need to get involved in the management. They need to understand clearly the step of management and the benefit about it, maybe for perhaps, or just don't make it like you're giving them lectures. So let's discuss a few options of treatment. If we have options, it would be great to tell the patient the options and what he would prefer. So let's discuss a few options of treatment and we would see what would be best for you. So including you and the patient. So we would see what would be the best for you, because you're going to decide with me what's best for you. So you can ask in the end, like after discussing the options, what do you think would be best for you? So he will tell you, like, I don't want to see a specialist now, just if you can give me some medication here. If he has depression, I don't want to go to psychiatric. Can you just give me treatment? Of course, we can give you, GB can give antidepressant treatment as well. So I'm really sorry to hear. I'm really sorry that this has happened. Yeah, so like medical error. So I'm really sorry that this has happened. Or if he has any personal accident, anything happened to them, I'm really sorry that this has happened. I'm worried about colleague stations. I'm worried about your getting to the hospital late. Is everything all right? I'm concerned about your behavior today. Are you all right? cocaine stations. How are things going? Colleague stations. So this is just some few examples, but we have a lot in the past as well. It doesn't matter, you can say few sentences, but the way you say them, the way you explore the patient's idea and concern, the way you explore the symptoms they're telling you about it, it makes a huge difference. All right, so now we can practice all together. Focus on your communication skills. Don't focus what other DD I'm going to ask. No, focus just in your communication skills. And as I said, always like to make even your DD limited, let the patient tell you everything before you start your DD. So ask, do you have any other symptoms, anything else before you start asking. So always open questions, take everything from the patient head before you start taking the station yourself, because you can complicate it more, you can waste more time. So they may guide you through the station very easily and finish even in a very short time. You'll be surprised when you start, like before you ask any question, ask the patient first open question just to tell you what they have in their head before you start your close questions. It will save you lots of times, because the patient clearly will tell you, I have these conditions and I don't have any other problem. And even if you ask them any DD question, they will quickly tell you no, because for negative symptoms, they will say no, they wouldn't talk a lot. And you will find yourself going the right track. And you can get very high marks even without know what the station about, trust me. As far as you now, you all have more than enough time. Started to write down your frame. I'm going to do this, I'm going to make a plan for yourself. Like when you go to the exam, apply this plan for all stations confidently, with the right tone, with a slow down, with the sympathy and empathy, facial expressions. Okay, so let's get practice.
Okay.